What's up, everyone? Jeff from Lewis Physical Therapy and Sports Rehab here. I want to talk today about the role of the foot and ankle complex and how we go about preparing it, whether this is for an athlete or individual that comes into us that has never really worked on training their foot and ankle or really doesn't have much training history in general, someone that is going through the rehab process for a lower body injury, and notice how I said lower body, not just foot and ankle, we're going to come back to that, or that someone is at the beginning of their kind of off-season prep period. So kind of getting right into it. The big role of the foot and ankle complex is, especially when we're talking about not only walking, but jogging, running, cutting, any dynamic movement like that, jumping, is the role of force absorption. When you're performing these impact-based activities, your foot and ankle complex needs to be able to absorb the force of the ground. When you step down or run, you put force in the ground puts force back into you. You need to be able to absorb that through the foot and ankle complex. Because if not, you have to look then at the proximal implications and effects. So proximal is really just meaning, in this case, above the foot and ankle, so your knee and your hip. If you cannot absorb force or produce force properly at the foot and ankle, well, where is that force absorption or production going to come from? And it's going to come from either the knee or the hip. And over time, if not addressed appropriately from a foot and ankle complex standpoint, that is where these kind of chronic cumulative injuries occur potentially. So, an example, when you have someone come in with a meniscus injury, for example, you have to look at their foot and ankle complex. Yes, you have to look at the knee, yes, the hip, for sure, no doubt about it. But you have to look at the foot and ankle complex. And I will say personally, earlier on in my career, and really not until about recently, that I really give more credit to the foot and ankle complex when treating these injuries. We look at the hip, make sure the glutes are in a good spot, minimizing the amount of dynamic valgus, for sure. You have to continue doing that. But you have to address the foot and ankle complex because it's the first thing that touches the ground and the first thing that has to absorb and then produce energy as well as we're going through these dynamic movements. So again, the role of knee and hip pain, you have to look at the foot and ankle. So another perfect example, you have a runner or someone that has some type of gluteal tendinopathy. Well, we know there's going to be a big likely component of dynamic valgus whenever they do any impact-based stuff. So yes, you have to hit that glute from a long duration isometric standpoint, training them in those positions to minimize valgus, no doubt about that. However, if we take care of that, but we don't look at, okay, when they hit the ground, that entire midfoot complex just loses all stability. Now they can't produce force off of it. Well, now we're going to be in trouble because, yes, the glute has been addressed, but okay, if we keep running on this, is this just going to come back to a degree? So that's how we look at the role of the kind of foot and ankle when dealing with knee and hip pain. Footwear, I'm going to briefly touch on this because it's a topic that's commonly talked about there. Whether your footwear is hurting or helping, in general, I would say it's very person dependent. You have some people that walk on or that run on very cushiony shoes, say it's saved their feet. Other people, they hate it and it hurts their feet. In general, what I would say is you need to make sure you have some type of supplemental work for the foot and ankle complex outside of the footwear, which we're going to get into here. So that is very much, I'm not going to sit here and say you have to do this, you have to do this from a footwear. It is very person dependent. Some things work better than others. What works well for one person does not for the other, and vice versa. So be mindful of that with footwear. You need to be able to supplement it. If you wear very cushiony shoes that are going to take away the proprioceptive input and the ability of your intrinsic muscles to stabilize your foot, you probably need to have some barefoot work in there as long as it's appropriate for your case. This one kind of ties into this up here, into the ground versus over the ground. So the force absorption, are you absorbing your force into the ground, or are you absorbing it into the foot and ankle complex itself that you can then produce the force over the ground? So again, you need to have the two here. You can absorb force into the foot and ankle complex and then, the corresponding structures above appropriately, and then produce force over the ground. So you're sprinting over the ground, things like that, versus just kind of falling into the ground. So your foot hits the ground and you kind of just fall into it. You can't maintain stiffness, which stiffness we talk about from a tendon rehab standpoint is really just the ability to resist deformation. So to be met with some type of force, hold position firmly, absorb that kinetic energy, and then reproduce it from a force production standpoint. So now getting into the big thing here, and again, there's another second part of this video that's going to be attached to this, or as part of this, that's going to go over the loading more in depth. So I'm not going to talk about the specifics too much. That's going to be part of the next half of this video. But loading the Gastroc and Soleus. So these are general rules of thumbs I go off of when we're looking at how do we start someone from phase one, which the next part of the back half of this video is going to be about, and progress them from there. For most people, we're going to start them in all isometric-based stuff. I don't really care about getting right to eccentrics. This is not necessarily talking to rehab, like with rehab, especially for lower bodies, for foot and ankle stuff. We jump right into eccentrics way too quick, in my opinion. But you have to do isometric stuff. So it might be you're doing a double leg isometric calf raise for 1 minute, 2 minutes. I need to make sure you can hold those positions, not only hold them, but maintain intent and hold good, produce good tension in those positions for the designated amount of time. All too often, you see someone or people that can do 6, 8, 10 eccentrics off a step. You put them in an isometric calf raise, and by 30, 45 seconds, they are either fatigued, if they're doing it properly, or they lose tension. They're just kind of hanging out. Like, I don't like just hanging out in position. You need to be able to produce intent and tension in those positions. So isometric to eccentric, generally, I like to see if they can get to the point where they can do it at 1 to 2 minutes before we progress potentially some other variations. Double leg to single leg, start double leg. It's going to be tough at first. If you go right to single leg, you're probably not going to be able to meet the desired time under tension if you're doing it properly. Starting body weight, then go into resisted. So again, body weight holds for a long period of time. Then we're going to get to the point where we're doing it with a weight vest. You can do them in a Kaiser air squat, dumbbell, kettlebell. You can get as creative as you want to with it. And then lastly is shin angle. Generally early on, we're going to start with the relatively vertical shin angle because it's not going to be as stressful on that foot and ankle complex, specifically the Achilles. When we do get to the point as you start progressing things, I do want to get into a more horizontal shin ankle position, which is going to be, especially for our field sport athletes, much more indicative of those acceleration type mechanics and a lot greater stress on the soleus and the Achilles more than anything. But again, most people, you put them in that position, they are going to struggle maintaining tension. They might be able just to hang out in that position, but can they truly maintain tension there? Which we're going to talk about. You're going to see in the next video what that looks like. So again, these are all things that I want to be thinking about when we're looking at how we prepare the foot and ankle for a lot of things. So you have a young athlete that's never sprinted before, and you're really trying to clean up their mechanics. You want to make sure they go with good mechanics. I might do a lot of these to teach them positions. So with these isometrics, we are teaching structural stability, structural awareness, and strength in certain positions. That's going to be a big piece of just laying that groundwork for anyone that's going through the rehab process off season or as a young training age. So now we're going to move into the demonstration of kind of the phase 1 introductory footwork that we will do for these individuals we mentioned. All right, this is going to be part 1 of our foot and ankle prep series. So for all the exercises that we're going to show here, these are all going to be double leg from a loading standpoint. We will do some kind of single leg intrinsic work to start. These are all going to be double leg. These are for individuals that are either coming fresh off of rehab, off season, working with someone that really does not have much exposure to the kind of foot and ankle work we're going to do. So it's going to be all isometric based, all body weight, and double leg with a relatively kind of less aggressive, more conservative shin angle. So first thing we want to teach these individuals is how do we essentially create pressure and stabilize through our foot. So what we want to think about is the foot as a tripod. Big toe, little toe, and the heel more than anything. So we want to think about having, when our foot is flat on the ground, equal contact throughout those 3 parts. So if I'm standing this way here, again, all of this has to be done barefoot in my opinion. All of our calf work, I think, should be done barefoot. I think when you do calf work with a shoe, unless it's a really minimal type 0 drop shoe, it is going to fundamentally change the way that you are essentially creating an absorbing force throughout your foot. Now, in a rehab setting and whatnot, you do need to be mindful of not doing this. You might be using a shoe at first. Perfect example is, if you have someone that has been unweighted for a while, and whether it's after an Achilles surgery or whatever it is, you go right to doing barefoot kind of calf work. It might be a challenge for them. Like, they might develop some pain at their big toe because they don't necessarily have the callus and supporting tissue underneath that they would normally get from walking. So be mindful of that. But we want to think about creating that tripod. So big toe, little toe, and the foot here. And what I want to think about is you can hold on here. I want them to get essentially into a single leg stance with keeping their quad engaged, knee straight, their glute is squeezed, and they have that tall pelvis position. So they're not here, they're not here. Then this tall pelvic position. And they're keeping those 3 points of contact there. And this might be all we do at first, is making sure they're in that position there. Now, what's going to happen a lot of times for a lot of the patients we see is anytime they're either on their foot here, they're doing calf work, they're rolling onto that lateral board of the foot. So they go up on their toes. So let's just say in this case, they go up on their toes, and they're kind of coming out. Their big toes are coming off the ground. And that immediately tells us this individual does not have a great ability to likely absorb force, but produce it in the right direction. So where does it go then? It goes upwards to the knee and the hip. So I'm going to, that was in probably the last video. We talked more about the proximal implications, but be mindful of that. So again, we want to think about as cueing what we call short foot. So what is short foot? What short foot is not is this toe yoga nonsense of you just curling your toes like this, where now you are lifting essentially that, the big toe joint off the floor. What short foot is the ability to quite literally shorten your foot. So you want to think about bringing essentially or shortening the distance from the big toe joint to the heel while keeping a relatively quiet toe. So by doing so, if you can see here, I'm literally kind of pulling my arch upward like that. So you should feel some tightening underneath. Again, I am not curling my toe aggressively like that and bringing that joint up off the floor. So that's one thing we want to be mindful of. So that is teaching us how we stabilize our foot there. So again, teach the short foot standing, approximate that area, and then get into this single leg standing position, teaching you how to hold that position rather than just kind of falling into things passively. So now going on to the loading, that kind of phase 1 loading of the Gastroc and the Soleus. So we want to make sure we're hitting both. Both are powerful plantar flexors. I think probably people have a relatively, undertrained Soleus for certain positions. I wouldn't say undertrained, but they're not necessarily exposed to those ranges before they get into sprinting to a degree. I'm not going to get into the topic of why Achilles injuries are happening or anything like that, but we're going to jump right into it here. So what you are going to need, you can either have a plate, you can have a step. I'm going to use a step for this video, and I have a ball here, which you're going to see. So now we're going to jump into our Gastroc and Soleus loading. So the first thing we're going to do is just a double leg isometric heel raise. So I have a ball here. The ball is going to go between my heel like so. So what it is not is what we see in posterior tibialis rehab and stuff online, where people go up and they squeeze the ever-living heck out of that ball by inverting their calcaneus or heel there. With this case, I honestly cue people like the ball is just there. I just want you to have your feet close enough where that ball has some pressure by approximating your feet in, and the ball is not going to fall down. So when we go up on our toes here, what I want us thinking about is we are predominantly pushing through the joint of the big toe and the big toe itself. Because what's going to happen is if you either aggressively go in like that, you're going to feel pressure against the ball, which I don't want. Or if you are someone that goes up and you kind of fall on the outside part of your foot, that ball is going to fall out. So again, when we're going here, my big toe is on the edge here, and I am pushing up. And I want you to think about, you're trying to bring that heel, like not literally over the toe, but you're bringing it up towards and over the toe as close as it can be. And again, you're going to find you're going to have to kind of reassess as you're going through your isometric hold. So again, for isometric hold, I'm here, I'm pushing up, and I'm quite literally just holding in that position. That is all that I'm doing there. And I'm making sure I am driving through the big toe more than anything. So that's the first one from loading the Gastroc. Now, from a Soleus standpoint, what we're going to do, again, this is also double leg. You're going to be here. I'm going to shorten up my straps. I'm going to need a little bit more or a little bit less length here, rather. And what I'm going to do is I'm going to have both my feet kind of right outside shoulder width apart. Feet are right on the edge here. And I'm going to keep my heels. I'm not letting my heels dip down. I'm going to be in this position here. I'm going to drop down a mini squat. And then from there, I am pushing up through the big toe. And again, Soleus is going to be a lot more kind of underneath this area, underneath the calf. And we are just holding that area, pushing through the big toe. Now you might feel some quad. You might feel some glute and hip loading as well. But again, I want you to think about that kind of heel is getting over those toes. So again, these from a phase 1 standpoint, this is all double leg to teach the position more than anything. If we go single leg right away, it might be too fatiguing for someone to be able to do that. It's all double leg, it's all body weight, it's all isometric. Ideally, we get to a point where you can hold this for a minute, maybe 2 minutes. Maybe you probably can't do that right out of the jump. If you're working on this in season, we have to be a lot more diligent about how we go about implementing that from a duration standpoint more than anything. But those are the 3 things to work on from a phase 1 foot and ankle preparation standpoint. We have teaching the tripod, teaching the short foot, and then loading of the Gastroc and the Soleus in relatively conservative angles.